Over here now, Brazil, Spain, Israel. Okay, let's still come back and take a look at something. Okay, I got this response to my Israel COVID-19 report. The vaccines are not designed to prevent infection. They are designed to prevent death. That's bullshit. They are designed to do just that, but don't achieve it anymore. For now, COVID-19 is less lethal if vaccinated. Let's see how that goes. I'll be right back. I'll get me a cup of coffee. Let you think about that there. Okay, let's just take a look at something really quick here. Okay, this is Worcester University's Institute of Health Metrics and Evaluation. Let's take a look at the United States. Now, a couple things here. Uh, Reported deaths are the number of deaths officially reported as COVID-19. Excess deaths are the number of deaths uh, estimated to estimated as attributed to COVID-19, including unreported deaths. But this is the one I want you to take a note of here. Daily deaths is the best indicator of a progress of a pandemic, although there's generally a 17 to 21 day lag between infection and death. Again, daily deaths, okay, are the best indicator of a COVID-19. Let's get rid of some of the other factors here. So see, they did back last year to predict a huge down spike. Now, how much of this is vaccine remains to be seen. Unmasked. You know what this line here? This line is called a drop chart. So interesting. If they are predicting a spike towards the end of September, but then they're saying it's going to drop back down to what 500 per day on estimate. Interesting, huh? You notice you don't say anything about there's hospital sources. Yes, they do track of infection and texting, mask use, social distancing, and so forth. Uh, but they still say that he does that a single mass measure of a spread of progress of a pandemic. We'll go make a reply over here. Let's see. There, so now respond to that guy. Okay, so now let's get back over here to Israel now. Now, you can see currently Israel, you have 90. Before we get started, Israel, don't forget to click that subscribe button. By the way, what do we got here? How many of my fans voted for me, viewed this video yesterday? Okay, 48 people viewed in Israel, or 48 people were interested enough in the COVID-19 situation in Israel to watch this video yesterday. That's fantastic. Thanks so much for those 48 likes and 48 views. Of course, as we always say, 48 views equals 48 likes. So now I need you to take that extra step when you watch this video, click on the like. And of course, I also need you to if you haven't done so already, click on the subscribe. And also don't forget to click on the share button. Share this video with your Facebook, your Twitter, fans today. Also, copy and paste the link into an email or text message and share it that way. Okay, so let's get on with the show now. You can see here that this is the concern. But as the guy correctly pointed out, COVID-19 vaccines, at least in the U.S., are not designed to keep you from getting COVID-19. They're designed to keep you to reduce the chance that you'll die from COVID-19. Of course, you know what? Probably 90% of the people who got the vaccine wouldn't have died from COVID-19 in the first place because it is too young. Okay? I mean, the highest percentage of deaths is still among people 65 and older, which includes me, by the way. But anyway, as you can see, on August the 11th, Israel, you had 7,668 cases. For the 7-day period ending August the 8th, you were averaging 4,638 cases per day. Now, what about deaths? Now, we are seeing a spike up in deaths up till 19. Wow. So what's causing this? Well, you know, more cases should mean more deaths, but the mortality rate, the percentage of people dying from COVID-19 should continue to remain fairly low. Okay, because it does not guarantee that you will not die from COVID-19. It simply reduces the chances. Okay, but still, again, 16 deaths on August 11th, 7-day moving average on August the 8th. You were for the 7-day period ending August the 8th. You were averaging 12 deaths per day. Okay. Now we got this 4, 5, 6 week incline here, increase in cases here, but that's okay. Look at this period over here. Okay, the last 2 weeks were a little bit more steep in terms of COVID-19 deaths in Israel. This is probably so you have last week was 50 deaths. Week before that was 60 deaths, but that's still pretty low. That's still really low deaths. Okay. When I hate to sound like a broken record, but no one's saying that the COVID-19 vaccine is going to completely eliminate COVID-19 deaths. As far as I know, no one's saying, okay, that's true of any country. Anyway, you can see your cases are still very low, 50,000 for August so far. About well, say about 27,000 uh, in July for cases. But you know what? You're still below this number here. This is 1, 2, 3, 4, 5, 6, 7 months in a row. You go finish below these three numbers right there. Okay, that's it. In my book, that's a victory. I mean, look how crazy low your monthly deaths are. Look at this period back over here. 1, 2, 3, 4. 4 months in a row, a decline, a slight spike up here, but 1, 2, 3, 4, 5, 6, 7 months in a row now. Your COVID-19 deaths are going to finish below this high back over here, all right? Which is 1,500 for the month. Okay, this spike was about, let's say, 1,500 deaths for the month for January 2021. Okay, and now down here, this is 250. So over here now you're about 125 deaths for the month of August so far. So that does conclude your report today, Israel. Well, thank you so much for your time today. Hey, don't forget to again a big shout out to those 48 people who watched this video yesterday. Like I say, 48 views equals 48 likes. So don't forget to click the like button today. Also, of course, if for some reason you haven't subscribed, click that subscribe button. And finally, click on the share button. Share the video on Facebook and Twitter. And you can also share it on, copy and paste the link to the video into an email and share it on uh, an email or text message that way. Okay. Thanks so much again for your time, Israel. We'll catch you tomorrow with an updated report.